Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If you have hand pain and you think that your job is causing you to have carpal tunnel syndrome, it's a natural thing to wonder because many stressful jobs are associated with carpal tunnel syndrome. Many people happen to have carpal tunnel syndrome and at the same time are in high-stress occupations like office jobs. But aside from any apparent cause and effect relationship between stress and carpal tunnel syndrome, there is no scientific link between the two. So this leaves us to wonder how a large proportion of office workers have carpal tunnel syndrome. And the answer may be simpler than you think. People who work in offices use their hands a lot, primarily because they use a mouse and keyboard. So if you're under stress and you're sitting at your workstation, your posture tends to suffer. You either slouch or hunch over your workstation. Thus, if you're under stress and at your workstation, you tend to hurry at your job, and that hurrying will lead to poor posture. And poor posture happens to be one of the very well-known causes of hand pain. Thus, your job's stress is not causing you to have carpal tunnel syndrome. Rather, the stress is causing you to have poor posture, and that is what's causing the problem in your hand. Sometimes poor posture isn't as easy to identify as in this picture. Oftentimes, we think we have good posture, but in reality, we don't. Proper posture, especially while sitting at the workstation, is essential for healthy hands. This is an example of good posture at a workstation. It's easy to maintain once we recognize what we have to do. But if you already have carpal tunnel syndrome, what do you do right now? The answer is quite easy, and that is to have deep tissue massage of your wrist and forearm every day for 2 to 4 weeks. In fact, deep tissue massage is nearly 100% effective in relieving carpal tunnel syndrome, but only if it's done daily and for a period of 2 to 4 weeks. This type of deep tissue massage on your wrist and forearm drains excess fluid, breaks adhesions, and enlarges the carpal tunnel. All of that results in a reduction of inflammation, swelling, and pain, and ultimately your carpal tunnel syndrome. Discuss this highly effective therapy with your doctor. And if you're thinking about having surgery for your carpal tunnel syndrome, discuss with your doctor the fact that most people are dissatisfied with their surgical results, while the overwhelming majority of people who use non-surgical therapy are very satisfied with their results. Your doctor should candidly and openly inform you of this because those statistics are so important that the Association of Orthopedic Surgeons and the National Institutes of Health recommend that all patients try all non-surgical options before considering surgery. Those non-surgical therapies that everyone should use start with resting your hand, splinting your hand while you sleep or night splinting, and deep tissue massage. And to get professional and effective deep tissue massage therapy for your carpal tunnel syndrome, you don't have to visit a therapist every day. Instead, the Carpal RX will give you the same therapy at home. If you have carpal tunnel syndrome, you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. If the Carpal RX doesn't relieve your symptoms, or if you just don't like it for any reason, return it for a full refund, including all of your shipping costs. The Carpal RX automatically produces the same motions that a therapist uses to relieve pain and other symptoms. And it's so simple to use. Just plug it in, slide it on, and strap it in. Then relax. The Carpal RX will do the rest. The Carpal RX always has a 60-day free trial, so if you're not completely satisfied with your results, return it for a 100% refund, including all your shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, as well as wrist tendonitis and repetitive strain injury. Visit the Carpal RX at carpalrx.com.